It's been about 3 months since surgery, and what's happened, the recovery since my last video. Thing is, I've been having some issues with the nerves. I think the nerve is called the periodontal nerve, where it goes from the bottom of your spine to the genitalia. It's pretty much the clitor and hood, right next to their urethra, going down the side into the vaginal canal. That's where I've been having the issue lately with the nerves on both sides. But mostly, it's the right side where I've been feeling it the most, which sucks. And at times it's less painful, and there's times where it's more painful. So I'm just still waiting for that to heal. And the only other things that I've been noticing is the vaginal canal. Well, I'm still having the hormone cycle as normal, female hormone cycle. And I've noticed the smell down there. Since the smell has pretty much come back, and with the hormone cycle, I've noticed the smell's changing based on that, which I've never heard anyone talk about that before who's had the surgery. But I'm mentioning it because it's what I'm noticing with my body. So, yeah. And it was weird this morning when I was dilating, checking things out. I noticed the way the smell was. If you think of like fish sticks. Yeah. That's what it was smelling like. But not like anything abnormal or anything. So, yeah. The other thing I've noticed, where the labias are, labia minora and labia majora, I can actually, since there's been more healing, there's been more like distinct separation where you can tell this one's the labia minora and this one's the labia majora. It's not like mushed into like one, like piece that's like smooth together. You can actually see the difference where the separation is, how it's all connected. So yeah, which the more it's doing that, the more happier I am with the look. But I'm still, even though everything's normal, I'm still debating on that revision, because the way mine is, that asymmetry, it's still, everything's still normal and good. My last doctor's appointment was for my hormones check and a post-op check to get everything checked out, because she wanted, because my doctor I'm seeing for my hormones, she's also a gynecologist and trans specialist. So she wanted me to see her 3 months after surgery to have that post-op check and hormone levels checked. I'm still waiting to hear back from them about my hormones levels. But at the appointment there, she was checking for like regrowth of hair where it shouldn't have been and other things. And she was saying that with my vaginal canal, I have lots of room for dilating. And the other doctors and the surgeon was saying that because I have a narrow pelvis, I may not be able to get as deep, like the depth as deep. But when she was saying that I have lots of room, I was just noticing how quickly this last few weeks dilating has gone. I've increased the depth. I'm now at the 4th dot on the dilator, the orange dilator, which is 5 inches. So since surgery to now, I went from a little less than the 1st dot all the way up to the 4th dot. And it was just the last few weeks, it just really increased in depth the last 2 weeks. It was like so weird, especially this last week. I was like, how did I increase that quickly? It's just my body's like reacting to it a lot better. But I'm noticing when I first started dilating, I couldn't get much depth and the canal was like tighter towards the entrance. And now the entrance is a lot more looser. Then I've noticed like the first half of the vaginal canal towards the entrance is looser, but towards the back is much tighter, where I've barely reached like 5 inches. Towards the back it's a little bit tighter because I haven't dilated that part long enough. So it's getting easier to dilate, just training my body to that it's okay to loosen everything so it's not so tight. And in turn, I've noticed the issues I was having before surgery with all the urinary issues and whatnot. It's actually helping with all that, with everything being a lot looser and not as tight. Because before surgery, when everything was together, it was really tight and causing so many issues. And now those issues are just like pretty much almost 100% gone. So yeah. And other things I've been noticing since surgery up to now, since my last video and like now, because the hormone difference, I'm not quite sure where everything's at yet, but with my hormone difference, I've noticed my body is going through some more changes, like physical changes. I've gained weight. Well, when I was weighed last, they weighed me 127, but that's with clothing and shoes on. And usually my shoes, each one together is 2 pounds. So when I weighed myself, when I personally weighed myself, was 125. So I've gained weight. Like in the tummy area, I have a little bit more there. My butt and my breasts are where I've gained. And I've been noticing that it's like it's not the whole breasts, I can say, but certain parts are filling in where it was lacking. So it's pretty much like the outer sides. I've noticed there's a lot more tissue, breast tissue, throughout the bottom, and the tissue on top. I noticed is spread more, like have more, but I've noticed it's like every time my breasts increase in size, the tops are still shallow, even though I have more tissue there. So yeah, and if they continue the way it's going, then I'm not quite sure what I would do about bras. Because trying to find what fits me, because having shallow breasts makes it a little more difficult to find bras that fit right. That's always been my issue through my whole transition, especially now, because if I gain another cup size, the brand I'm currently using, they don't make a cup size bigger, so yeah. But I'm currently at a fuller 32 triple D/F American sizing, and I have some bras that are becoming too small, some that fit, so I'm in that weird awkward stage where I don't fit in a cup size bigger, but what I'm currently wearing is becoming too small, so it's like, yeah, that weird in between. So, and I still haven't had dysphoria from my genitalia. That still hasn't happened. Even though at times my emotions still drop, but it hasn't been as bad. So yeah. Other than that, I'm still doing good and happy with how everything's healing and how my body's going. And the thing is, it's coming to mind right now is my weight. For some reason, I feel better weighing more. I don't know why. I just mentally, I just feel better. And physically, I noticed when my weight dropped clear down to 116, when that happened, compared to now, because I notice when my weight drops like that, I don't feel as good, but when my weight's up where it's at now, I feel really good. I just don't feel like I have issues. But I just wish in the tummy area all through here, I'm just wishing I wouldn't gain through the tummy area is the thing. I wanted to go directly to my breasts and my butt until my breasts finally finished filling in, doing what they're going to do, and my butt continuing. And last, I measured my hips because my butt has gotten bigger. Last I measured, it was 35 inches. That means I went from 34 to 35 inches on my hip measurement. So that's a good thing for me because I've had a hard time before surgery. I struggled to gain anything in my hips because I went from 33 to 34, and that was about it, around 34, 34 and a half, and gaining in my butt now, and there's a little bit more in my hips. Gaining that has actually helped, and its clothing fits better because of it. So yeah, which the way my body's going, I'm comfortable with it. It's just around the tummy area and the waist is where I don't really want to gain. But just being filled in, it feels better, but not like if you know what I'm talking about. Like filled in feels better instead of like gaining where it sticks out. If you, yeah, that's what I'm like trying to say. But anyways, I just feel happier, and it's overall, I look better and I feel better, especially when I've noticed, like right now, my face is one place I've noticed. If you can see all this cuteness, it just looks better and it feels better with everything filled in. And I'm just so thankful I was able to get the surgery and having these further changes, because it's really helping my mental health a lot with who I am as a person. Where to at points, because I tend to hold my emotions in a lot. And when that happens, when it finally comes out, I end up wanting to cry, but in a good way with all these changes I've had. So, yeah, really happy. So glad that everything's happened the way it's happened. The only thing I'm not quite liking, I've noticed at times, it's not all the time, it's just like those rare moments. It's like sexually, or it's like when you're sexually in the mood or aroused, I can say. Those rare moments where you get those phantom feelings of what it was before. That happens. Of what it was down there before needing to do it like sexual that way. Those sexual feelings of how it was before surgery in that weird way, which I don't like that, but it's something that does happen. But other than that, just trying to trigger the body down there to just with physical therapy, or just still trying to get everything genitalia wise to normalize and send the signals that it's okay to be touched and to do all these different things it's normally supposed to do. So I don't have these issues with the nerves and things being tight where it's tight, or stinging where it's stinging. That's what's being worked on with physical therapy. So, yeah. And I'm still not quite sure about needling, that technique she mentioned, to help with the nerves I keep twitching, because it keeps pulling the clitoris down towards the pubic bone when I'm laying. That's something that's kind of uncomfortable sometimes. I notice when it happens too much, it triggers an orgasm. So just trying to prevent that as well. And with the needling, it's basically needle on the spots that it needs it, and shooting electricity into it to calm everything down. And I'm not into electricity like that, so I'm like, or needles being poked in random places like that. Just like, nope. So that's something I'm not quite sure for my appointment tomorrow, the physical therapist. So, yeah. So I just have to decide if I want that done or not. And personally, I don't want it done. So, yeah. So that's what's been going on with all this. Trying to get everything back to normal. So, the spots that's still swollen, is right next to the urethra on both sides. And it's the right side is where it's stinging, where I'm having that issue. That's pretty much the only spots that's still really swollen. And trying to get that to fully heal and all the scar tissue that's left. And that lump I had that ended up bleeding, the lump went away. The pocket that was filled in has gone away, but there's still a small little lump that's flattened out. So, yeah. And the scar tissue, like, not the scar tissue, but the along the stitch line on the left side is what I'm still working on, trying to get that flattened out. Because everything on the right side's almost completely healed, pretty much, except the upper part. But it's that upper half, I can say, on the left side, like the upper part of it, still having issues with that, trying to get it flattened out, and that scar line to start healing more, just having issues with that side. So, but other than that, everything still looks really good, uniquely individualized to my body. So, yeah, other than that, happy with it all. So, until my next video, please comment on anything. If you're curious or wondering, just anything that I haven't talked about or mentioned. If you want to know something, just let me know. Just comment and let me know, and I will answer those questions. That's what these videos are for, to help you out there, to educate on my experience, what's going on with me and my transition and surgery. So if there's anything I haven't mentioned that you may need to know or want to know, please comment and I will answer those questions. So yeah, to my next video, comment, rate, and subscribe until the next update.